Oklahoma's unemployment rate is one of the lowest in the nation. The latest rankings from the Bureau of Labor Statistics show Oklahoma's unemployment rate at 4.5%, much lower than the national average of 6.1%. But for one segment of Oklahoma's population, the unemployment rate is sky high.
More than 5% of Oklahoma's population is suffering from mental illness, ranking it the second highest in the nation. The repercussions reveal themselves in a number of ways. Homeless people seen on the streets, people abusing drugs and alcohol to ease mental conflicts, overcrowded state prisons where 36% of the inmates have a mental illness diagnosis. The executive director of the Mental Health Association of Oklahoma, Mike Brose, believes many Oklahoma leaders and the public generally disregard that portion of the population.
Let's expand our definition of diversity. Let's be more inclusive to include people who live in recovery with mental illness, who have histories of substance abuse, who live in recovery, and who maybe made a mistake and had a felony conviction, may or may not been incarcerated. Let's take a look. Let's relook at that population.
Brose is not surprised by the recent report from the National Alliance on Mental Health that says 80% of Oklahomans served by public mental health programs are unemployed.
I have a felony DUI. Many employers, they don't care. They don't care if it's violent or nonviolent. They just see felony, and that's a huge strike against you. So I know, I can't speak for anyone else, but I know I felt and feel discriminated against.
In our state, we have incarcerated so many people. So we have now, in a stack of applications, you have a stack of applications that have been eliminated because people have checked that box that says they have a felony conviction.
Leslie Farringer had mental health issues that led her into an alcoholic world where she lost her husband, children, and a career as a college professor. Before getting into recovery, she was homeless for 7 years. Today, she's employed by the Oklahoma Mental Health Association and helps others like Nathan Pruitt.
She helps me by just believing in me, I guess you could say, and I mean, that's the main thing.
The Salvation Army is where Nathan laid his head to rest each night for 2 years before becoming eligible for a publicly funded apartment. Medication has brought Nathan's bipolar disorder under control, and he would like to work.
I think so. It'd build my self-esteem up a little bit better. Make me feel better about myself, knowing I'm able to actually do something and maybe please people.
Nathan has yet to find someone willing to hire him. He spends some of his time at Denver House in Tulsa, where others struggling with mental illness and/or homelessness can drop in to feel a sense of community and get help rebuilding their lives. Max Parker manages Denver House.
We've seen people come in here and get organized. See, we don't always do all the work for everybody. We do provide a safe respite outside of to come get organized, get your life together. If you want our help, we do light case management. We'll do advocacy for you. We'll help you fill out forms, help you get IDs, birth certificates, things like that.
Mirrored after the Denver House, the Mental Health Association opened the doors to the Lottie House in Oklahoma City last year. The people who work at both locations have walked the same path as the people they're helping. Max began suffering from psychosis in his late teens, but with medication and counseling, he got a master's degree in social science. He credits the Mental Health Association for hiring him.
They're giving people a chance that nobody else is giving a chance. It's actually seen as a strength, not a weakness. That's why I work here.
The association employs 130 people. A survey of employees revealed 60% live in recovery with mental illness. 50% have a history of substance abuse, and 45% have been homeless at least once.
I share those numbers and people say, oh, aren't you guys wonderful that you would hire these poor individuals? And I say, that ain't got anything to do with it. This is work. I hire these people because they have skills and they make really good employees.
Brose encourages all employers to tap into the workforce of people who are stabilized from their mental illness and are now willing and ready to work.